First of all, what is coronary artery bypass grafting? This gene has witnessed remarkable process in the past recent years, which is driven by new innovative techniques and refined approaches to follow to improve the patient's outcome. And the advent of minimal invasive cardiac surgery or robotic cardiac surgery has reduced the invasiveness and leading shorter recovery times and improved patient satisfaction also. Presently, the burden of CVs such like that WHO predicts by 2024, the global burden may amount to 1.5 billion people, which they lost their years due to disability or bad health or death. According to the estimates, 42.5 billion people in the United States alone will suffer or will pass away from coronary artery disease and its consequences in 2024. So, first of all, the indications for CABG. There are basically 4 or 5 indications for CABG, which include the left main artery disease or triple vessel coronary artery disease, reduced EF, which is known as abdominal left ventricular function, or MI, failed stenting, or occlusion of the graft from PTCR. This is just an overview of coronary artery anatomy. The heart is somewhere in between. Is the aorta, and the left vein coronary artery arises, which gives a branch anteriorly, which is the main branch, which is called left anterior descending artery. After that, this circumflex goes behind the heart, and this is the right coronary artery. Our main target in CABG is left anterior descending artery, which supplies approximately 60% of the heart. This is what happens to the arteries. This is the area of the artery, which was blocked due to plaque or in rupture of the ulcer. And this blood blocks in the artery, and this is the result. This is the incomplete area, the dead arteries. There are basically 2 techniques of CABG. One is on-pump CABG, other one is off-pump CABG. On-pump is a traditional conventional technique used since many years. It takes is done with arresting heart with cardioversion using cardiopulmonary bypass. The other one is the recent innovation, not actually some recent, it is off-pump, which is done without the use of cardiopulmonary bypass. This is a diagram for a setup for CABG. This is the open charge, and we get the heart. And these are 2 things which we use to stabilize the beating heart because of this off-pump. So this area is stabilized by this mechanism called octopus, and then they perform the study. And typically on an on-pump CABG, these are the 2 cannulas. One is going in the aorta and one in the right atrium. The blood flows out of the right atrium and goes into the aorta, so the heart is relatively relaxed and doesn't have to perform the work. For you, we mostly use CABG, most important is left internal memory artery. This is just behind the sternum, and it's a gold standard and with excellent long-term results. Another one is the vein graft, which is next most common use after. Its patency rate is around 10 years, 70%. And it can cause graft failure because of veins, they usually get decomposed or internal hyperplasia or atherosclerosis of the graft. This is a setup which actually the participant can take out the vein and go left, and this is the post-operative scar. We usually get this much length of vein for 2 grafts, and one is liver, which is these are most commonly grafts which we put in the CABG. Another one is right side, right internal thoracic artery, which is left nowadays because most of the surgeons now prefer total arterial revascularization in which one LED and then right internal thoracic artery. They both are taken now. But if you take both these things from sternum, so it creates a high rate of sternal infection or sternal ASS in these patients, especially if the patient is diabetic and the obese. The last one which we use usually in young patients with around 35 to 40 years of age is the radial artery. This is actually the heart looks like after the bypass. One end we joins to the aorta and another one to the after the block heart. Same as here, this is the internal coronary artery. This is the branch of subclavian. With proximal root have to be already attached. And distally after the block we join this. The blood now flow from this in this way. It bypasses this and goes to the heart. The standard precaution which we usually tell to the patient to follow 6 to 8 weeks is like they don't have to lift more weight, no pushing and pulling with the arms. They don't more things to go down overhead and do not leave behind your back or even both arms out to the side. We usually prescribe them a spinal binder for a few days. For that they have to let go of them by when they are squeezing, cuffing or sitting down. The recent advances in CABG for the past few years is one of the most important is coronary invasive CABG. This technique has revolutionized the traditional surgical approach because it usually uses thoracotomy incisions rather than a main sternotomy. Other one is robotic assisted surgery, and these small thoracotomy methods they lead to shorter recovery times and improve patient's satisfaction. Now, another one is the hybrid procedure, in which we combine both stenting and bypass at the same time. So, there are some difficult vessels which are difficult to bypass. They are deep. So, by stenting, we usually do a stent and then at the same time bypass the other vessels. And as far as grafts are concerned, the latest is the tissue injury, particularly the utilization of total arterial grafts, as I just told you. Or we presently have intraoperative imaging and intraoperative graft flow measurement. So that what graft we have put, we just check on the table that the graft is running or not. Minimally invasive surgery is also known as weight gap. And while this sternotomy and cardiopulmonary bypass usually causes a lengthy hospital stay and delayed recovery, but at the same time, weight gap are designed to lessen the stress of surgery and improve patient's outcome and speedy recovery. And tiny thoracotomy incision, minimal surgical trauma, they passing the healing process. This is what it looks like. We just open with a minimal scar, just right side, and this thing holds the stabilizes the heart. Hybrid procedure, just I told you, it combines CABG with PCI. It's done with the interaction of cardiac surgery and interventional cardiology. It deals with complex cases that might not be suitable for standard techniques alone. And in multiple vessel disease, we use PCI for less severe patients and CABG of the most important coronary artery, which is usually the ILD. This prevents the necessity for reduced sternotomy by maintaining both the advantages of the both techniques. The latest is the tissue image, in which we are, the scientists are presently using and trying to develop the new grafts so that we don't have to lose the patient's healing anymore. These are broad view of minimally invasive. It use smaller incisions, can be done by robotics, it reduces pain, shorter hospital stay, and knockdown lessens the risk of stroke because we don't have to clamp the aorta. Aorta is usually calcified in these patients. By taking one bypass, if we clamp the aorta, then some connection might have broken down and go into the brain. So it reduces the risk of stroke. And total arterial hybrid and robotic assisted surgeries, when surgeon controls her robotic arms somewhere outside and perform the bypass artery. And imaging techniques have to we have intraoperative angiographic facilities and LED mapping and Doppler flow of the grafts can be checked. So that whatever we have done on table, we can decide whether we have to revise the graft or increase less flow, we can change the graft at the same time. Thank you. Both grafts, graft बना रहे हैं, तो हम पैथरी grafts होते हैं, तो bypass के लिए पैथरी उसको कोई graft ऐसे उसको RTC वो अगर साइज में बड़े होते हैं, उस हार्ट की वेसल्स के साइज के डेवलप अभी वही नहीं है।
Thank you so much, sir. Understanding the anatomy, the pathology, and the surgical procedure can help our physiotherapists. Also connecting with the surgeons is important. That which methodology was used to perform that surgery, so that we can plan our treatment with coordinate and we can give a profound treatment to our patients. So now we understand the role of physiotherapy in coronary artery bypass grafting. For this, I would like to invite Dr. Rajveer Singh Bhati, PG resident of Mahatma Physiotherapy College.
Good afternoon, respected faculty members, Dr. Aashis Sharma sir, Dr. Advisor, and respected faculty members. So let's proceed with the physiotherapy management in the coronary artery bypass grafting. Importance of physiotherapy in CABG. Pre-surgery physiotherapy management, which include improve physical fitness, enhance physical fitness, which increases the patient capacity for withstanding surgical stress. Enhance physical endurance, cause physiological changes in the anatomy. These changes enhance the patient overall clinical conditions. Now, post-surgery physiotherapy importance, reduce pain. The goal of physiotherapy are reduce pain, enhance the respiratory and peripheral muscle strength, reduce post-operative complications like coronary complications, and last is the shorten the duration of hospitalization. Pre-surgery physiotherapy basically goals. Optimize respiratory function and aim to improve the lung function and oxygenation before the surgery. Improve physical fitness, enhance the physical endurance and cause physiological changes in the anatomy, which increase the patient's capacity for withstanding surgical stress. This can reduce the length of stay in intensive care facilities and hospitals. Reduce post-operative complications. Pre-operative physical therapy helps to reduce post-operative radiological anomalies and improve quality of life in patients undergoing both abdominal and open heart surgery. Prepare for post-operative rehabilitation. Pre-operative period is an ideal time to educate the patient about the early mobilization and physical activity after the surgery. Now, the technique used in the pre-surgery physiotherapy management, that is incentive spirometry, ACBT, active cycle of breathing technique, respiratory muscle training, aerobic and endurance training, and relaxation therapy. Now, this is each in detail. Incentive spirometry purpose. Incentive spirometry is used to part of the operative physiotherapy to prevent the post-operative pulmonary complications such as appendicitis. Measure the patient used to incentive spirometry for 2 days pre-operatively along with the exercise of deep breathing and encourage talking. Benefits. It has been associated with the decreased incidence of appendicitis, reduced hospital stay, shorter mechanical ventilation duration, and improved post-operative oxygenation. Inspiration and execution of the spirometry. Then ACBT technique purpose. ACBT is the active breathing cycle technique performed by the patient that can be used to mobilize clear excess pulmonary secretions and generally improve lung function. It helps to reduce frequency of chest infection, improve the effectiveness of components of ACBT. First one is divided into 3 phases. First one is breathing control. This is used to relax the airway, relieve the symptoms of wheezing and tightness, which normally occur after coughing and breathlessness. Deep breathing exercise or thoracic extension exercises. These exercises help to improve ventilation in the lungs, huffing or forced expiratory technique. These techniques help to clear the secretion from the lungs. This is the flow chart. First we start with the breathing control, then 3 to 4 thoracic extension exercise, then again breath control, then again 3 to 4 thoracic extension exercise, then breath control, and then 1 to 2 pump. This is complete one cycle. Benefits. The randomized control has shown that positive effects of ACBT along with routine chest physiotherapy on arterial oxygenation, heart rate and pain perception following CABG. Implementation of CABG. Once the ACBT has been taught, the patient could be encouraged to use independently without supervision of physiotherapists. These exercises does not require the use of any special equipment. Then respiratory muscle training. This training often refers to the respiratory muscle training designed to strengthen the muscles using the inhalation. Steps involving the IMT, assessment of the respiratory muscle strength. Before starting the training, it is important to assess the patient's current respiratory muscle strength. This can be done using a device called manometer, which measures the maximum respiratory pressure (MIP). Then setting the training intensity. The intensity of the training is usually set as percentage of the patient's MIP. That could be ranged from between 30% to 60% of MIP. Using the IMT device, the patient used to IMT device to perform the exercise. This device provides resistance during the inhalation, which helps to strengthen the respiratory muscles. Performing the exercise, the patient inhales through the IMT device against the resistance. This should be done in slow and controlled manner. The patient should aim to inhale as quickly as possible. Duration and frequency of the training, the patient should perform exercise about 30 minutes per day, divided into 3 sessions. The training should be carried out for at least 2 weeks before the surgery. This is the device. Now, aerobic and endurance training purpose. The main goal of this training is to improve the patient all over physical condition and fitness before the surgery. This increases the patient capacity for withstanding surgical stress. The component of this training is warm-up, involving 5 to 10 minutes of easy light movement that prepare the muscle for aerobic and weight training exercise. An aerobic exercise involves 30 to 60 minutes of continuous exercise. The goal of this exercise is time, not the intensity. The example of aerobic exercise including walking, swimming, biking, or using a huge steps. The interval training, if the patient is able to perform 30 minutes of regular exercise, interval training can be tried. This involves varying exercise with easier to hard exercise. Cool down also 5 to 10 minutes of light movement helps to bring your heart rate back to the resting level. Then stretching, 5 minutes stretching, 5 minutes stretching. The benefits of this training is very sport and aerobic interval training that added to the conventional physiotherapy program provide prove to be significantly effective in improving endurance capacity, quality of life as compared with conventional cardiac rehabilitation alone after the coronary revascularization. Then relaxation therapy purpose. The main goal of relaxation therapy is reducing stress and anxiety, which can have significant effect on the patient's physiological response to the surgery. It helps to improve the patient capacity to accommodate major surgery. Technique involved basically involve the deep breathing exercise, progressive muscle relaxation, guiding agility, and mindful meditation. Benefits help to reduce the pre-operative anxiety, improve post-operative pain management, enhance the recovery, improve all-over patient satisfaction. Implementation, again, this technique can be used independently by the patient or do not use any special equipment. Evidence studies show that the relaxation therapy can be an effective component of pre-operative physiotherapy, contributing to improve the patient outcome. Then post-surgery physiotherapy management, divided into basically three phases. The first phase is the immediate post-operative period goes early mobilization, prevent respiratory complications, educate on external precautions. Activities include breathing exercise, diaphragmatic breathing, and safe air mobility and transfer, gradual ambulation. This is the diaphragmatic breathing. Put your hand on the air and breathing, expand the left. Then phase 2 timeline approximately 3 weeks post surgery to cardiovascular risk reduction, enhance access capacity. Technique involved supervised aerobic exercise, sessions of 20 to 30 minutes of cyclo-ergometer, general gymnastics 20 minutes daily, and progressive resistance training. Continue breathing exercise with rifle and walking program. Let's discuss each in a little bit detail. Purpose: improve patient all-over physical step after the surgery. Component: warm up for 5 to 10 minutes, lightweight resistance exercise, lightweight training, high repetition, 2 to 3 days per week. Start with one set of 15 repetitions per muscle of legs, depth, and chest, shoulder, and arms. Progressively gradually increase resistance or weight as the patient steps improve. Pull down 5 to 10 minutes of light movement. Benefits: reduce the PCSK9. It is a display enzyme which is produced in the liver, which help to involve in improving the LDL profile. Safety precautions: avoid chest exercise for minimum 12 weeks after the surgery. Once they clearance from the doctor, lightweight training may be done. General gymnastics purpose: improve the patient all over physical strength, flexibility, and endurance after the surgery. It also helps to improve the basic balance and coordination. Components: again, warm up for 5 to 10 minutes of easy and light movements. Gymnastic exercise, variety of movements that work different muscle groups. Duration: perform about 20 to 20 minutes each day. Benefits: improve the patient physical fitness, reduce the risk of post-operative complications, and enhance recovery. Safety: avoid any exercise that could excessive strain on the healing struggle. breathing exercise with the triangle. Improve lung function, prevent post-operative coronary complications such as arteries. Component deep breathing, take a deep breath with a strong breath once every 5 to 15 to 20 minutes. Inhalation inhales cause the three ball within the try to device to rise up and holding the breath with all the three balls hold them as long as possible. Frequency perform 10 times every hour. Regular use of microdose can improve the patient's physical fitness, reduce the risk of post-operative complications, and enhance the patient holding all three balls in the outside. Any inspiration? Then walking program. Purpose: improve the patient all-over physical fitness, cardiovascular fitness after the surgery. Warm-up of 5 to 10 minutes for easy light movements. Walking start with a short walk and then gradually increase the duration. Cool down 5 to 10 minutes of cool down. Frequency and duration. Aim to be walk 30 to 40 minutes every day by 6 weeks after the surgery. Performing twice a day for the next 4 to 6 weeks before starting cardiac activity. Indoor and outdoor walking. Walking indoor if the weather is extremely cold or hot, then high humidity, poor air quality, and the patient can walk 10 minutes. They may walk outdoor. Safety precautions. If the patient experience chest pain, shortness of breath, lightheadedness, and palpitation, they should stop their activity immediately. Post surgery phase 3, ongoing maintenance goal, long-term cardiovascular health, maintenance of exercise rhythm, activity under unsupervised aerobic and resistance training, lifestyle modification, and continue adherence to cardiovascular risk reduction strategies. Under unsupervised aerobic and resistance training involve purpose and encourage the patient to continue their exercise rhythm independently, which can help improve the overall physical strength, endurance, and cardiovascular fitness. Component which include aerobic exercise, continuous and interval training exercise such as walking, swimming, cycling. Start with short duration, gradually increase with endurance. Resistance exercise, lightweight training, high repetition, avoid the chest exercise for 12 weeks after surgery. Frequency should be aimed to perform aerobic exercise most days of the week and resistance exercise 2 to 3 days per week. And lifestyle modification, regular light exercise, patients are advised to engage in regular light exercise, lead to more active lifestyle. It can include walking program, general gymnastics, and unsupervised aerobic and resistance training. Healthy diet. Patients should eat the low cholesterol and low trans fat diet that can help prevent condition from recurring and support long-term recovery. Stress management important for post-operative recovery. They can be achieved by relaxation therapy, mindfulness, and smoke cessation. If the patient is a smoker, they should be encouraged to quit the smoking, increase the risk of complications, slow down the healing process, managing the diabetes, and regular follow-up.
Thank you so much, Rajveer, for explaining us the role of physiotherapy, pre-operatively as well as post-operatively, and helping your students understand that in different phases of the treatment we require to give a treatment, right? So for the phase 1, what is required, we should go for that initially, and then we should also go the progression, like how we can decide whether we have to move to the phase 2 exercise or we are just remaining at the phase 1 exercise. So we all need to understand the progression of the phases. So with this, I would like to invite Dr. Pragya Dadhich, Assistant Professor here in Mahatma Physiotherapy College, and she will be talking to us about the recent advancement in the coronary artery bypass grafting. We already discussed about the overview of about CABG. The recent advancement in coronary artery bypass grafting are Jacobson muscle relaxation techniques, transcutaneous electrical nerve stimulation, cryotherapy, beautiful breathing technique, and the follow-up is nostril breathing technique and hummingbee breathing technique. In the Jacobson muscle relaxation technique, progressive muscle relaxation was introduced by Jacobson and is one of the complementary medicine therapies. In this method, active contraction and expansion of the specific muscles lead to patient relaxation.
It has been introduced as an effective way to reduce stress, depression, improve sleep quality, and reduce fatigue and blood pressure without complication. It balances moderate and severe problems. Jacobson techniques is a type of therapy that focuses on tightening and relaxation specific muscle group in sequence. The conductive environment, the setting for relaxation is quiet and off distractions noises. The patient will be kept physically comfortable in the position. General instructions. This instruction is kept simple and is easily understood by patients exposed to Jacobson's progressive muscle relaxation technique and gives them a clear picture of how to cooperate during the exercise. To sit on a chair as comfortably as possible, keep your body loose, light and free, be calm and comfortable, keep your eyes closed, avoid stress thoughts, avoid extra movements of the body. During the part of the exercise cycle, tense the muscle tightly and hold for a slow count of 5 seconds. During the relaxation part of exercise cycle, relaxes the muscle quickly and completely. Let your mind relax and appreciate how relaxed the muscle is feeling for 10 seconds. Try to keep all other muscles relaxed as exercise specific muscle. As you exercise from head to toe, observe changes like tightness and the development of light and smooth sensations. Relax by taking 3 deep breaths, inhaling through nose and exhaling through mouth after each step. Now make your body completely loose, light and free. The procedure of Jacobson's progressive muscle relaxation technique. Hands clench each face separately. Feel the tension in the wrist and forearm respectively for 5 seconds. Release the wrist, relax and feel relaxation for 10 seconds. Arms, bend each arm separately up at the elbow and tense the biceps. Keeping the hand relaxed, feel the tension for 5 seconds. Release the arm, relax and feel relaxation for 10 seconds. Straighten the arms separately and tense the triceps, leaving the lower arms supported by the chair. With the hands relaxed, feel tensing for 5 seconds. Relax and feel relaxation for 10 seconds. Stretching muscle. Wrinkle your forehead. Try to make your eyebrows touch your hairline, which produces tension. Feel the tension for 5 seconds. Then release the eyebrows, relax and feel relaxation for 10 seconds. Then close your eyes and screw the muscles around the eyes for 5 seconds. Release, relax and feel relaxation for 10 seconds. Then tense the jaw by biting the teeth together. Feel the tension in the jaw muscle for 5 seconds. Release, relax and feel relaxation for 10 seconds. Then press the tongue hard and straight up in the roof of mouth with lips. Close, notice tension in throat and feel it for 5 seconds. Then release, relax and feel relaxation for 10 seconds. Then neck and shoulder, push the head back as far as it will go. Feel the tension for 5 seconds. Bring head to its position. Relax, feel and relaxation for 10 seconds. Bring the head down and press the chin down on the chest for 5 seconds. Then bring the head up to its position. Relax and feel relaxation for 10 seconds. Then tense shoulder by tightening and shrinking shoulders. Feel the tension for 5 seconds. Then release, relax and feel relaxation for 10 seconds. The chest, take a deep breath completely filling the lungs. Hold the breath for 2 seconds and passively exhale. Relax and feel relaxation for 10 seconds. In the stomach, pull in the stomach and tense the stomach muscle for 5 seconds. Then release the stomach, relax and feel relaxation for 10 seconds. The back, arch your back away from the chair. Feel the tension for 5 seconds and then relax and feel relaxation for 10 seconds. And in thigh and buttocks, tense or thigh muscles and buttocks by squeezing muscles together and feel tensing for 5 seconds. Release the muscles, relax and feel relaxation for 10 seconds. The lower leg point close towards your head, producing tension in calf muscles. Feel tensing for 5 seconds. Relax and feel relaxation for 10 seconds. Point the toes away from your head. Feel the tension for 5 seconds. Relax and feel relaxation for 10 seconds. In the toes, relax and feel relaxation for 10 seconds. And after exercise, relax your whole body completely. Keep your eyes closed and let yourself remain in the relaxed position. Open your eyes and ensure you feel relaxed and refreshed. Sit up and stretch and stand up slowly. Now, TANS, transcutaneous electrical nerve stimulation. TANS is a complementary post-operative analgesic modality that is safe and effective in alleviating post-operative pain and improving patient recovery, resulting in better outcomes after thoracic surgery. The current evidence shows that TANS treatment is ineffective when used alone in patients with severe post-coilotomy pain, but useful as an adjunct to other analgesic medications in moderate post-coilotomy pain, and very effective as the sole pain control treatment in patients with mild post-coilotomy. TANS therapy can reduce the need for additional analgesic doses, thus minimizing the total dose of analgesic medications and thereby reducing their side effects. TANS also relieves post-operative incision pain and ipsilateral shoulder pain. It can also be used for persistent incision pain after removal of an epidural or paravertebral block. TANS has multiple mechanisms of action. The first of which is closing the gates of pain perception in the brain. The second mechanism is that TANS stimulates the release of endogenous opioids for effective post-operative analgesia with anything. The intensity of the electric current should be strong but comfortable for the patient. The duration of TANS application can be for 20 to 30 minutes at 3-hour time intervals on the day following surgery. It is also possible to alternate high and low frequencies was found to be the most effective method because the alternation of high and low frequencies causes the release of different neurotransmitters, which have a synergistic effect of exogenously administered opioids. High and low frequency TANS has the advantages to delay the development compared to either low or high frequency TANS alone. Then the cryotherapy. Incisional pain could be managed using pharmacological and non-pharmacological interventions. The strong emphasis is non-pharmacological pain relief methods including relaxation, touch therapy, music therapy, and applying heat and cold therapy. Cold therapy is a non-pharmacological and a most effective way of relieving pain. The cold reduces pain by reducing the sensitivity of the nerve endings to pain and by reducing vasoconstriction, which reduces inflammation and swelling. It also used before or during coughing and deep breathing exercises to reduce the aggravation of incision pain. The procedure is that the frozen cold gel bag were placed in a cotton bag and were put on the incision area on the chest for 15 minutes. Besides, the incision area was covered with a thin layer of gauze. The bag elevated up to 45 to 90 degrees and a pillow was given to support incision area during conducting deep breathing and coughing. Now, the Buteyko breathing technique. The Buteyko breathing technique helps in reducing breathing to cause air hunger, which is equivalent to giving the body a small controlled dose of symptoms, which can be a great tactic for overcoming the fear of the sensations that comes with a full-blown panic attack and restoring normal breathing volume. The CABG surgery presents satisfactory results. However, external pain and dysfunctional breathing in the post-operative period resulting in post-pulmonary complications such as apnea. Mood disorder, weakness, worry, stress, and depression are common psychological repercussions, all of which are disabling and distressing. The procedure is that take a small silent breath in through your nose, allow a small silent breath out through your nose, hold your nose with your fingers to prevent air from entering your lungs, count the number of seconds until you feel the first distinct desire to breathe in. Breathe holding as one of the most powerful methods to Step 1 is sit straight and comfortable position. Step 2 is take a short, small breath. Step 3 is slowly exhale. And the step 4 is pinch the nose with fingers and hold the breath as long as you can. The step 5 is relax for 1 to 1.5 minutes and repeat the cycle. This breathing techniques also helps in reduces anxiety, improves mental clarity, calms the brain and body, improves sleep quality, lowers the elevated blood pressure. Now the follow-up. After discharge from hospital, patients may suffer from incision pain, breathlessness and easy fatiguability, resulting in limitations in their activities of daily life and poor quality of life. Healthy diet, aerobic training was safe and feasible for most operative patients, and also nostril breathing technique and humming breathing. The first one is Anulom Vilom Pranayama, also known as alternate nostril breathing technique and Nadi Shodhana Pranayama. It banishes and stress of body and mind. Pranayama, which means controlling our breath and its energies, can be powerful disabilities of mind and bones. A regular pranayama practice can improve brain health, breathe will become more shallow and rapid when you are feeling stressed. The humming breathing, also known as Bhati, is a calming breathing practice that soothes the nervous system and helps to connect us with our purest inner nature. Bhati, the Sanskrit word for bee, and this pranayama is so named because of the humming sound produced at the back of the throat during the practice, like the gentle humming of a bee. The effects of Bhati pranayama on brain. It is an intense way to relieve tension as well as anger and anxiety. It also improves the concentration and memory of the person. It can cure insomnia. It is quite beneficial for people suffering from Alzheimer's. It provides relief to a person in case he is feeling hot or